Living with age-related macular degeneration, it isn't just about what you can or can't see, is it? It's also so much about how you feel. So in this explainer, we're going to talk about that powerful, often unspoken connection between AMD and your emotional well-being. And most importantly, we're going to look at a clear path forward. Okay, let's get into it. And let's just start with the most important message, right out of the gate. If you're feeling this way, it is not a personal feeling. It's a completely understandable reaction to a massive life change. This isn't about weakness, it's about biology and circumstance. And the key thing to remember is there is real, effective help out there.
So let's really break down this connection. We're going to explore exactly how a condition in your eyes can have such a huge impact on your mind and, your day-to-day mood.
First things first, if this sounds at all familiar to you, if you've been feeling this persistent sadness or a new kind of worry since your diagnosis, please know you are in very good company. This is an extremely common experience. You are not alone in this. Just how common are we talking? Well, the research is pretty eye-opening, and the numbers are kind of staggering. Studies have shown that as many as 44% of people living with AMD experience significant symptoms of depression. Just think about that for a second. That's nearly 1 out of every 2 people.
And it's not just depression. Anxiety is a major player here too. Some studies find symptoms in up to 30% of people with AMD. So yeah, the numbers really paint a picture here. These aren't just isolated incidents. They're widespread, predictable challenges that come along with vision loss.
Okay, so we know it's common, but why, right? What's actually happening that connects the health of your retina to how you feel every day? Let's dig into that.
And it's a totally fair question. Is this just about being sad that your vision is changing, or is there a deeper mechanism at play here? Well, the answer is there's a lot more to it. Well, a big part of it is actually a pretty clear chain of events. The vision loss from AMD makes things like reading or driving or even seeing a friend's face across the room really tough. Naturally, this leads you to do less of those things. And when you stop doing the things you love, especially with other people, it can quickly lead to social isolation. And that is a direct path to feeling down. But that's not the whole story. There's also the very real fear of the future, the uncertainty of it all. And then you go deeper, to a biological level, and it turns out the same kind of inflammation and cellular stress that are involved in AMD, well, they're also linked to depression. You add in other health issues that are common as we get older, and you can see how it creates this perfect storm. This is exactly why paying attention to your mood isn't some soft issue. It's absolutely critical to your overall health and to managing your AMD. The ripple effects are huge.
So the big takeaway here is that letting these feelings go unaddressed isn't just about feeling unhappy. It can have real, tangible consequences for your physical health, your safety, and, believe it or not, even how well your eye treatments work. Just look at this comparison. On one side, if mood symptoms aren't addressed, you're looking at a lower quality of life, a harder time sticking with important treatments like eye injections, and even a higher risk of falls. But look at the other side. With the right support, the picture completely changes. Quality of life goes up, it's easier to stick with your treatment, and your overall safety is boosted. The choice is pretty stark, right? Okay, now for the best part. We've talked about the problem, but let's shift our focus to the solutions. And the really great news is there are proven, effective ways to get help and to start feeling better. And you know what? That whole journey starts with one super simple first step. Just asking to be screened. It's quick, it's easy, and it's a really powerful way to open the door to getting the support you need.
Your doctor can use these simple questionnaires to just check in on your mood. You might hear names like the PHQ-9 for depression or the GAD-7 for anxiety. Don't think of these as scary tests, honestly. Just think of them as a standard checkup for your emotional health, no different than getting your blood pressure checked.
And once a screening shows that, hey, maybe you could use a little extra support, a whole world of effective options opens right up. And this isn't guesswork. These are treatments backed by solid research. They work.
One of the most powerful tools in the toolbox is something called Low-Vision Rehabilitation, or LVR. Now, this isn't about reversing AMD. It's about empowering you. It's practical, hands-on training and tools that help you use the vision you have to its absolute fullest, so you can keep your independence and get back to doing the things you love. Another incredibly effective approach is a type of therapy called behavioral activation. And what's so great about it is how simple and direct it is. It's all about fighting back against that cycle of withdrawal we talked about earlier.
A therapist helps you pinpoint and then gradually get back into the positive activities that bring you joy and purpose.
And the list goes on. There are other types of practical therapy, new models of care that bring mental health support right into your regular doctor's office. And, of course, safe and effective medications. The main thing is there are options, and the care can be tailored specifically for you.
So what does this all mean for you, right now, today? Let's put it all together into a clear, actionable path that you can start on immediately.
Okay, here's your game plan. Just 3 simple steps. 1, at your very next appointment, ask for a mood screening. You can literally just say, I'd like to do a PHQ-9. 2, ask for a referral to low-vision rehabilitation. It is a critical part of good AMD care. And 3, work with your team to treat and monitor how you're feeling, creating a plan that's just for you.
So let's just recap the most important stuff. Feeling down or anxious with AMD is common, it's normal, and it is absolutely treatable. Your first move is to ask for a screening and referral to LVR. Practical therapies like behavioral activation are literally designed to help you get your life back. And please remember this above all else. This is a predictable response to vision loss. It is not a reflection on you or your character.
And we'll leave you with this thought. Your vision is changing. That's a fact of AMD, but you still have so much control. You have a choice in how you adapt, the support you ask for, and the future you want to build. So, how will you choose to see it?